All right, welcome back to Self Principle. As always, I'm Dr. Hashmi. Now, today's topic is all about what is the link between probiotics and asthma. So let's get started. The first study is the PROPEN study. This stands for Probiotics in Pediatric Asthma Management. It was published in early 2022 in the Annals of Allergy, Asthma, and Immunology. And in this particular study, the researchers were using a mixture of two different probiotic species or strains. The first one was Bifidobacterium breve B632, and the second one was Ligulactobacillus salivarius or LS01. And the idea was to see that could supplementation with both of these strains somehow affect the number of asthma exacerbations. Now, the concept behind this study was that somehow the thought was that probiotic intake would affect patients who had allergy going on, and allergies were a trigger for asthma exacerbations. So in the PROPEN study, they had 164 kids with allergy going on. The average age was about 8.8 years, and they were split between 36% girls and about 64% boys going on. Now, they gave them these supplements for 4 months, and essentially the first 8 weeks of the study, or the first 2 months of the study, they took the supplements twice a day, or in the placebo arm, they took placebo twice a day. And in the remainder 8 weeks, or the last 2 months of the study, they took the placebo arm or the probiotics once a day going on. And when they went ahead and did a post hoc analysis, what they found was that the children who had allergy, who received the probiotic supplement, they actually had a significant reductions in their asthma exacerbations. The odds ratio was 0.18 or 82% less going on. Now, in the second study that was done, this is another randomized double-blind trial that was conducted between January 2019 and January 2020 in a hospital in Bangkok, Thailand. Now, in this particular study, they actually used a different strain. They used Bifidobacterium infantis 35624, and they used about 1 billion colony-forming units going on. So it was either Bifidobacterium infantis or placebo, and they gave it twice a day for 4 weeks, and there were 60 patients in the study going on. Now, there's a number of really interesting results that came out of this study. So the first thing was, after 4 weeks, 93% of the patients who were in the probiotic group versus only 35% of the patients in the placebo group actually had their asthma well controlled based on the clinical definition going on. That's a significant difference. And at 8 weeks, 100% of the probiotic group versus 57.1% of the placebo group had well-controlled asthma going on, once again defined by clinical standards. In addition to that, the probiotic group also had significant increases in something known as forced vital capacity. Now, this is just a simple way of saying how strongly you can breathe out during our pulmonary function test going on. In addition to that, the probiotic group also had lower use of their rescue inhalers. How much? Well, they were using it on average 1 puff versus 11 puffs in the control arm going on. So once again, it is a pretty significant difference. And the most interesting part of the study was that when they looked at the treatment arm, the folks getting the probiotics at 4 weeks going on, what they found was that they actually had a significantly lower number of T regulatory cells. The concept here is that as part of asthma, there's all of these sort of dysfunctional or dysregulated T functional cells that the probiotics are now downregulating. And by downregulating them, they're actually making it easier to control asthma. So, looking at both of these studies, what is the take-home message? What can you do right now if, God forbid, your child suffers from asthma? The take-home really is one, of course, they always need more, better controlled, longer-term studies. Remember, these are only going on for a very short amount of time. But adding probiotics along with all of your medical regimen that's already there, the risk-to-benefit ratio is actually risk is low, and there may possibly be a benefit going on. Now, one of the things that I truly believe here is that there may actually be a wide variety of probiotics that may have similar functions as Bifidobacterium infantis, or as we talked about in the previous study going on with Bifidobacterium breve or the Lactobacillus salivarius, either one of the three going on. So having probiotics for your kids may be great. If you're into food, remember fermented foods are a great source of probiotics going on. As always, thanks so much for checking out this episode. If you got questions, you got comments, you got a topic you want me to cover, just drop me a note in the comments or send me a message and I'll be sure to cover it next time. Thanks so much.